Welcome to our product demo session today with Dr. Chimeze Uche, the founder and CEO of Doctroid Healthcare Services. Dr. Chimeze Uche is a visionary leader and healthcare innovator, renowned for pioneering projects such as Nigeria's first electronic medical record system, the country's first tele-ECG reporting system, and medical collaboration services, a unique public-private partnership for deploying medical infrastructure. As the founder and CEO of Doctroid Healthcare Services Limited, he has been at the forefront of health tech innovation, also co-founding Cintio Healthcare and Kazeba.ng, a last mile logistics company transforming digital delivery services in Nigeria. Dr. Uche is Vice President at Navin Technology Services Limited, where he co-developed the Medical Collaboration Services Initiative and serves as Tech Focus Coordinator for the Southeast Economic Development Project. He's an advocate for startups. He mentors African entrepreneurs through the Tony Elumelu Foundation and has trained founders on business growth strategies at the African FinTech Foundry. With expertise in business strategy, product development, project management, and process optimization, Dr. Uche is a speaker, mentor, and business coach, and he has played a pivotal role in establishing the Southeast's first children's specialist hospital through a public-private partnership with the Abia State government. So Dr. Uche today will present us Doctroid, an innovative approach to addressing healthcare gaps in Southeast Africa. So thank you very much, Dr. Uche, for being here today. Welcome.
Thank you, Faidat. Thanks to the Rec Tech team, organizers of this amazing event. I'm super delighted to be here, and I'll be sharing what myself and my team have been doing with Doctroid Healthcare. Doctroid Healthcare is my new baby, as I like to put it. It's less than a year old. Next slide, please. All right, so for us, this is more like a personal project, if you allow me to use that word. So in 2020, my dad was attacked by petty thieves who came to his country home in Southeast. He was 80 that year, and they beat him up during the day. Sorry, at night when he went to the POS during the day. By the time we got a nurse to go check him up, I told nurse, please, when you get to town, when you take them to town, kindly get an ECG done. That was the first. That was when we had the first lockdown COVID period. They couldn't get any. They couldn't get any ECG. This is Abia State of 2020. By the time I went back next day, I traveled that next day. It was same story. Recently, he got hospitalized for a condition with which he probably would have told me, all right, which had informed me earlier, but it was diagnosed late. So I started thinking that line, elderly people are, suffering, so to say. Many of them on the same ward with him, about 50% passed on that short during that 4 week period. They presented late. They all presented late. I mean, the elder landscape, we have about 25 million of them, age 65 and above. I know this number is going to triple in by 2050. So I realized that hey, something has to be done. These people are sort of marginalized for access to healthcare. Next slide, please. So I started looking at a lot of other problems. Next slide, please. Admin Alpha, could you kindly go to the next slide? All right, so this is who we are. We believe every senior citizen or elder deserves back to the thought. Okay, so we believe they deserve dignified, accessible, and proactive healthcare. As such, we introduce a subscription-based elderly care support that is helping to transform how we care for Nigeria's aging population. This really is simplified, in-home, and on-demand. My profile has been read. That is who I am. Next slide, please. So we identify the following problems. We realize that these people have inadequate access to healthcare due to several reasons. All right, many of them face immobility issues and distance from facilities. The closest government facility to my hometown is about 30 minutes. My dad at the moment is 84, so he hardly drives. So you see, he thinks, and many of them in that category, and that's how it is. That's how it is in many other communities in Nigeria. We also realize that, hey, their care is fragmented. All right. They often lack coordination, leading to poor management of chronic illnesses and missed preventive care opportunities. We also realize that they face certain social isolation. Aging individuals, they often face loneliness and they are got limited emotional support, which adversely affects their mental health. We also realize that many of them lack specialized elderly care. All right, limited service is specially designed for aging individuals, leaving many without access to consistent, age-appropriate healthcare. No tailor-made healthcare service for them. All right, if people are trying the geriatric space, but hey, we realized it wasn't enough. And of course, the health insurance is not targeted at them. Many of them are pensioners, all right, and still battling with their PFAs and all that. And of course, there's a high out-of-pocket expense. My dad was hospitalized for 4 weeks. Myself and my siblings spent close to 2 million as I speak with you. If we didn't have the money, probably mine would have been in the past at the moment. Next slide, please. And so we thought of a solution that can help manage all this. And then we decided a subscription-based elderly care support service. We have four variants, four products as well. When we did our analysis, we realized that many of them came down with NCDs, non-communicable diseases. So we looked at many of them, what kind of solution can we design that will appropriately take care of all these and the varying other ones, the various other ones, malaria and all that. So we designed this. Classic has so we have the classic, executive, premium, and prestige products. They all have their different constituents as well, or their offerings. Yeah. So, but all of them consist of doctor's visit, body comprehensive check, inclusive of an ultrasound scan. They can have ECG done. They got chest X-ray and a couple of other X-rays done. End-to-end lab services. So we felt okay, we'll check HbA1c rather than then continuous either fasting blood glucose or random blood glucose. And then we felt okay, ACRO2 will help tell us the state of their kidney, and then C-reactive protein will also help check inflammation in the body. We also have lipid profile to be done and all that. Next slide, please. So but these packages come in different quantity, if you allow me use that word, and onto premium and prestige. And this is scalable. A month ago, we were thinking, hey, let's look at Southeast. And then we felt, hey, we can use Southeast to validate regional deployment and implementation, and then we can move on to other senatorial zones in the country. They all face similar challenges. So it's scalable across all senatorial zones in the country. We intend doing 12 zones per year, so that in 7 years we should have reached out to the 109 zones and have this deployed in every senatorial zone down to local governments and wards and all that. Next slide, please. Okay, how it works? Just hit so everyone. There's a beneficiary, who is the elderly, and there's a sponsor. Our findings realize that in Nigeria, as is culturally done, most children take care of their parents at old age. And we also are taking advantage. Our go-to-market strategy also involves, aside reaching out to the children of these parents, of these elderly folks, we're reaching out to community development associations. We're about signing MOU with one that is willing to pool funds together and pay 1 year subscription for over 500 plus of their elderly ones in their community. So we are going through that route. We're going through churches, we're going through market associations to get healthcare to them. So the sponsor logs in, creates an account, and then subscribe for a plan for a beneficiary. The beneficiary can also go online if they have Android phones. But our findings realize that shows us also that more than 50% of them still make use of feature phones. So it's a step-by-step registration. If you hit Doctroid Healthcare, you hit subscription packages, you see all the packages, you click a plan, you fill a form, you're up. We also have a data management system plugged into the website that helps the care practitioners do their documentation when they visit, helps upload lab results and all that. Now, this is purely preventive. We do not treat. All right. But if your medications, we can help do refill for you. And if they need to see doctor, we advise them. We take them to the closest medical facility, and then also help help manage the whole process. So it's a personalized health assessment. We are also looking at implementing that. We've not implemented that yet, so that we know we have a medical history from the outset. But now we're helping them build their medical history because many of them don't know. Um, During our test use case, we realized that even children don't know the ages of their parents. So we hope to build all this from scratch. Subscription is, we have right now with allowing card payments, but we are partnered with we're looking at partnering with some microfinance banks so that we can allow for bank transfers. Okay. Yeah, service delivery. They receive care quarterly. So once in 3 months, they get a doctor's visit. They get this comprehensive check done. Of course, it comes with health education and a whole lot of others. Next slide, please. Okay. Like I said, we're about onboarding 500 plus elderly clients. We are operationalizing all our strategy by December 9th. December 9th, we're going full operations. We've been building the past 4 months, building our data management system and our portal and the site, and then manually checking out other things we found. Next slide, please. All right. So, what do you think? We're hoping we get people come on board. We are signing partnerships. We have also signed partnership with a medical concierge that has a network of specialist doctors that we can also take advantage of their services. Together, we are hoping to create a future where our elders live healthier, happier, and longer lives. Thank you very much. I'll take questions if there are questions. Next slide, please. Next slide shows our contact details. Yeah, so I can be reached via cu@doctroidhealthcare.com, or you can send an inquiry to enquiries@doctroidhealthcare.com. Someone respond to you in 24 hours. Thank you. I appreciate it, class. That's our website and our phone numbers. Thank you very much. So honored to be on this platform today. Waidat, are you still here?
Thank you so much, Dr. Chimete, for that presentation.
Thank you, Waidat. Thank you so
Great
much.
hearing about the work that you're doing.
Thank you.
Thank you very much for joining us today. And we'll see you again in our next panel session.
Yeah.
So, to our participants, thank you for staying with us this far. I'm sure you're learning and advancing your knowledge of digital health innovation in Africa. Next up is our second panel session for today, panel session 2, digital health infrastructure, public private investments, and partnerships. So, in this session, you gain insights into how collaborative investments between the public and private sectors are driving sustainable and scalable healthcare infrastructure solutions across Africa. After that panel session, we still have for you an interesting case study from Mara Frank, the Chief Impact and Growth Officer at Doctors for Madagascar. And then our final session would be our panel session addressing health data governance and privacy challenges. So stay tuned for those sessions, and remember you get a certificate of participation at the end of the conference. So now it's time to join our second panel session, titled Panel Session 2, Digital Healthcare Infrastructure, Public-Private Investments and Partnerships. To join this panel session, please leave this session and go back to the conference site. On the conference site, you go to the agenda at the top menu of the site and then click on the live tab to see the session that's currently active. Then finally click on the join button on the right of the next session's topic and you're in. So a banner would be displayed now to guide you into joining the next session. So thank you.